We do have the top people here at the World Health Assembly, and there are some major issues in health that we want to talk about that aren't necessarily on the agenda today, might be happening next week. One of those is where we're going to start today, and that's something called non-communicable diseases. And rest assured, in the UN, we can even give that an acronym. We call them NCDs. But you know them as things like cancer, diabetes, heart disease, stroke, and chronic respiratory diseases like asthma. I think it's fair to say that this group of diseases probably affects everyone. If it doesn't affect them personally, it affects somebody that they care a lot about. And that's why it's such an important topic for us today. They can be prevented and they can be treated. And WHO is working to do that. Now, joining me to talk about that, Dr. Alwan, the Regional Director from the Eastern Mediterranean region at WHO and a long-standing champion of putting strategies in place to reduce non-communicable diseases, and Dr. Silvana Luciani from the Americas region. You work on non-communicable diseases in the Americas region and getting strategies to the countries there. I want to thank you both for joining me today. NCDs really are the biggest killer. From what I've read. In fact, I think we're looking at about 38 million deaths a year. Is that right?
You are correct.
All
absolutely.
Right. 16 million can be premature, die before somebody's 70 years old?
Yes, that's a very important point, is that many people with NCDs are actually dying too young. And premature death, premature disability due to non-communicable diseases is obviously of great socioeconomic importance, because NCDs today are not just a health problem, a major health problem, a leading cause of death, but they are also one of the most serious threats to socioeconomic development in the 21st century.
If you have questions for either one of these experts, then go ahead and send them in on Twitter. That's hashtag WHA68 and hashtag SocialGood. Dr. Alwan, about 3.5 years ago, the UN General Assembly met in New York for a special session on non-communicable diseases. That's very rare that they do a special session on a health issue. Why did they do that?
Well, you're absolutely correct, because this is the second time that the UN General Assembly addresses at the level of the heads of states and government a health issue. And the reason is because of the enormous socioeconomic impact of NCDs. So they are responsible for more than 63% of all deaths globally. And a great proportion of the deaths are actually premature, and they happen during the most productive period of people's life. And so these are also conditions that are very expensive to treat. They cause disabilities, and they cause, of course, loss of productivity. And so that's actually the reason why NCDs have moved from the World Health Assembly, and this is the annual meeting of Ministers of Health, to the General Assembly, because it's not just a health issue, it's much bigger than a health issue.
All right, so explain to me then, we're trying to prevent premature deaths, reduce premature deaths. We're trying to prevent these conditions from even starting to begin with. How do we do that? What is being done?
Well, let's go back to what we actually mean by NCDs. NCDs are a large group of conditions, but about 80% of the people who die from NCDs, they die from 4 major groups of diseases. You actually mentioned them at the beginning of this session. So cardiovascular diseases, which include heart attacks and strokes, diabetes, cancers, and chronic lung diseases like chronic obstructive lung disease or asthma. And these 4 major groups of diseases are actually caused by 4 major risk factors. So it's tobacco use, it's unhealthy diet, it's physical inactivity, and it's the harmful use of alcohol. So we have 4 groups of diseases and 4 shared risk factors. And so if we want to prevent these diseases from occurring, and we prevent premature death, then we need to act on the risk factors, to reduce the risk factors. And so it is the global strategy to address these NCDs was actually approved by WHO, or the World Health Assembly, in the year 2000. It's very simple. You need to do, number one, monitor these 4 groups of disease and the risk factors. You need to reduce the risk factors that cause them. This is number 2. And you need to provide healthcare, proper healthcare, for the millions and millions of people who have these conditions. And so these are the 3 key components of any strategy to address NCDs at the national level, at the global level, at the regional level, and even at the subnational level.
So when a yellow card comes up here, this means that we've had a question come in off Twitter. This particular question was the one that I just asked, actually, what is being done to prevent NCDs. So I'm just going to pretend that I was reading your mind. And if anybody else would like me to read your mind, hashtag WHA68, hashtag SocialGood. Dr. Alwan, one more question for you. What are countries doing to implement some of these programs to reduce these risk factors?
So what did the UN meeting do in 2011? The heads of states and government endorsed what we call a political declaration. And this political declaration contains a number of measures and interventions that each member state should do to address NCDs in the 3 areas that I have mentioned: in surveillance, monitoring, tracking the epidemic, in reducing the risk factors, and also in improving healthcare for people with established NCDs. So what member states are now doing or expected to do is actually to implement these measures. So they have to have a comprehensive system to monitor the risk factors and the diseases, and they have to have what we call the best buys. The best buys are measures to reduce the risk factors. These are evidence-based, they are cost-effective, they are feasible, they are culturally relevant, and they are low cost. In fact, some of them, like taxation on tobacco and taxation on alcohol, are income generating. So every single country in the world can implement these public health best buys. In some cases, they generate more funds, but in other best buys are easy to implement and they are low cost. And the third groups of measures that the UN recommends to member states are measures to integrate the management and the healthcare of the common non-communicable disease like high blood pressure that affects 40% of the adult population in most regions of the world, or diabetes in some regions of the world that affects about 25% of the adult population. And to integrate the management and healthcare of these conditions into primary healthcare.
Silvana, let me come to you for just a moment. You work in the Americas region trying to implement some of this work and try to get some of these countries taking this forward. You need to share your microphone with her, and I will ask her the tough questions that have just come in.
Thank you.
Before I do that, why don't you kind of set the scene for me, if you would.
Yes.
What is the situation in the Americas region? Are some of these countries taking this work forward?
Thank you, Christy. And I think the really important point to make about NCDs is that human suffering is insurmountable. You know, Dr. Alwan explained the global situation in the Americas. The situation is that every 3 out of 4 deaths is caused by non-communicable diseases. And that is a real tragedy in terms of human life lost. But it's also that there are millions, over 200 million in the region of the Americas that are living with an NCD. So having to manage their blood pressure, having to manage their diabetes, having to live with cancer. And there are millions more that are at high risk of developing in the future an NCD because they're smokers or because they don't follow a healthy pattern of life. And so the impact that this quantity of people who use the health services, the impact it's having on the health services is overwhelming in terms of the cost, impact in terms of productivity and loss to the economy, and it really is affecting the development of the countries in the Americas region, which are predominantly middle-income countries. And so we're really pleased that the political push to take this issue of NCDs to the United Nations in 2011 originated in our region with the Caribbean heads of state that convened a meeting and had a heads of state, so not with the ministries of health, but heads of state had a commitment to address NCDs across different sectors of government and take this to the highest level. Because there's a real recognition that although we know what to do, as Dr. Alwan has described in terms of the WHO best buys, the how you do it is really going to require that political will and that political commitment. And I'm happy to say that in our region we have been able to sustain that level of political commitment and will since 2011 a high-level meeting. And almost all the countries in our region now have developed NCD plans, have put in place policies. So we've seen a lot of progress politically, but also in terms of strengthening their risk factor reduction policies and strengthening health services.
I've got two questions that have come in from Twitter. I'm going to ask them together because we're running out of time. The first one you touched on just a moment ago, and that is, how has the increase in NCDs affected the region? And the second is, how can communications and health education help prevent chronic diseases? Can you take both of those for me?
Sure, yeah. I'll start with the second one because I think it's a really critical point that communications and health education are critical to create this culture of wellness and healthy living and adopting healthy patterns of life. But it also goes with creating this social movement and this public demand for healthier environments, because we know that the real causes of non-communicable diseases are a result of globalization and urbanization and having, cheap, unhealthy foods available where it costs more to buy water than it does to, say, a sugary beverage. And so I think having a lot more communication messages to change behavior but also change those public policies that create the healthy environments is important. And then the first question around how has the rise in non-communicable diseases impacted, I think it is the growing number of people that use the health services, but it's also just a larger proportion of the population that are sick and not being able to contribute to the productive economy of a country. And I really want to draw attention to two important factors related to non-communicable diseases. The first is tobacco, because tobacco is clearly the single most important risk factor for all the non-communicable diseases. And we do have a framework convention of tobacco control that WHO adopted in 2003, and that's really helped push the countries put in place all of the policy measures like taxation and warning signals to reduce tobacco, but we still have a long way to go because tobacco and smoking are high, especially among adolescents. And then the second most important, I think, is obesity. The obesity problem is enormous and growing, especially among children, and a lot more needs to be done to promote healthy eating and physical activity and create those healthy environments. Dr. Alwan, do you have anything to add?
I would just like to add an important component of the strategy is to get the non-health sectors to be engaged in addressing NCDs. So you can educate people, you can tell them not to smoke, you can tell them to eat healthy, but they actually need an environment that is conducive to this kind of lifestyle. So this requires action by a number of other sectors and not just health. And that is why non-communicable diseases, addressing them is not an issue for health authorities alone. And that is again another reason for taking the non-communicable disease issue into the General Assembly of the UN, because it requires a multi-sectoral action. We have something that we call health in all policies, which means that the non-health sectors have to be engaged in reducing the risk factors and producing an environment that is conducive to healthy lifestyles.
I think that also illustrates probably one of the biggest challenges about this as well.
Absolutely.
I'm going to let both of you go because we're out of time, but I think you can already see the high interest in this topic. Thank you both for joining us. I appreciate it.
Thank you,
Silvana,
Christy.
Luciani, and Dr. Alwan. Thank you.